Um, so we will go ahead and start. We'd like to start off actually with a dua, which I'll share my screen again momentarily. We'll put that on, and I think I'm not sure if it's Brother Seth or Brother Abdurrahman who's going to be reciting and saying a few words about Hazrat Bilal. So.
All right. Assalamu alaikum, everyone. So before we get started, I'll just read a very short dua. Bismillah ar-Rahman ar-Rahim. اللهم صل على سيدنا محمد وعلى آل سيدنا محمد وبارك وسلم. يا أيها الناس إنا خلقناكم من ذكر وأنثى وجعلناكم شعوبا وقبائل لتعارفوا إن أكرمكم عند الله أتقاكم إن الله عليم خبير. And the translation goes, O mankind, behold, we have created you all out of male and female, and have made you into nations and tribes, so that you might come to know one another. Verily, the noblest of you in the sight of God is the one who is most deeply conscious of Him. Behold, God is all-knowing and all-aware. Ameen, may Allah accept.
Thank you. Again, I don't know if we have anybody who wants to say a few words about Sayyidina Bilal. In any case, as Sister Fatima mentioned, we are dedicating the project to him, who, again, we feel was a true warrior for the underserved, and at the heart of this project is, serving the underserved.
I was going to say a few words if there's time.
Of course, please go ahead.
Oops. Okay, Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon, everyone. My name is Muhammad Saifullah. I was the former coordinator of the project until I had to step away. So, alhamdulillah, I'm honored to continue to be involved in whatever little bit capacity. So, I've been asked by Miss Fatima to talk about our connection, this connection that we're making for the EMPART project to Sayyidina Bilal radiallahu anh. So I will just take a few moments to just make that connection. So this project, one of the major components of this project is health equity. And health equity is, of course, a major component of public health in general. And the idea is that we want to promote health for everyone, not just equally, but equitably, because every community has certain challenges and obstacles. And when we provide health services, we have to make sure that we cater to those specific challenges. And that's what differentiates equity from equality. So equity kind of takes it a step further. Now, unfortunately, given the circumstances in our society, with all the unfortunate issues around racism, etc., we decided to include this emphasis of social justice in the project. And as everyone might be aware, in public health, you cannot have health equity. You cannot truly have health equity without social justice. So because this project is focusing on the Muslim community, we wanted to mention this particular, one of the greatest examples of social justice in Islam. So as we heard the verse being recited, this is the message of Islam, that the various differences that we might find in our communities, whether it be race or religion, etc. And these are all ways by which we can get to know one another and learn from each other. They're not a way by which we discriminate and which we unfortunately use to undermine certain communities. So that is absolutely inappropriate. And of course, that's the message of Islam, that we get to know one another and we learn from another. And those who are the best from among us, as a verse, as was recited, are those who are most conscious of God. So that's the message being promoted. And in Islamic history, we have the example of Bilal ibn Rabah radiallahu anh, who was among the greatest companions of the Prophet Muhammad sallallahu alaihi wasallam. So very briefly, the story goes that Bilal was actually an African slave in the in Arabia at the time of the Prophet Muhammad. And when the Prophet started spreading the message of Islam, it really appealed to Bilal, and he accepted the message. He was among the first individuals to accept the message of the Prophet. And unfortunately, those he was under did not take very kindly to it, and he had to go through a lot of hardship, but he remained steadfast and he attained his freedom and went on to have a major impact and play an influential role in the spread of Islam and in the victories and the influence of Islam. So, and of course, attained the prestigious title of being the mu'adhin of the Prophet, the one who would call the Prophet and the companions to prayer. So every time we give the call to prayer, we remember Bilal radiallahu anh. So subhanAllah, this goes to show that, everyone has the potential and everyone should be given the opportunity. So that's kind of what we're doing with EMPART, with respects to health, and with respect to health equity, that we want to make sure that everyone, in particular a community which is underserved and is facing a lot of health disparities, attains an equitable opportunity to a healthy living, so that we all can do our best and make a difference in society. Thank you. Jazakallah.
Jazakallah, Brother Seth. Thank you so much for those words. And with that, we shall kick things off. So Assalamu alaikum, everybody. Again, my name is Nabil, and I am part of the steering committee for the EMPART project. I'm a program developer. Briefly, before we introduce our honored guest and chairperson, I just wanted to acknowledge the partnership of the Initiative in Islam and Medicine, as well as Pastors for PCOR, and Dr. Padella and Dr. Johnson, from those respective organizations, as well as our 5 mosque community partners, whose logos you can see down below. And also just want to mention Dr. Kamal Derawi, as well as acknowledging our wonderful team of dynamic community health workers who you'll all be introduced to very shortly as well. I'm just going to quickly explain what the agenda looks like for this hour and a half or so, and then we'll get started with the main events. Just briefly, our goal for this meeting. So this is our kickoff meeting for the EMPART project, which, in case you didn't know, EMPART stands for Equipping Muslims with PCOR-based, action-oriented research tools. It's a mouthful. So we'll explain what that means in more detail as the event goes on. So the basic goal of this event is to describe our vision for this project, explain what all of those words, patient-centered, research, what all of those things mean, how they come together into our vision. We're going to introduce our platform and our team, and ultimately the goal is for us all to connect at this event. Alhamdulillah, we're blessed to have so many wonderful community organizers and leaders who are working in their own way to make the community better, and this is really a platform for us all to connect and work together in our shared visions. We're gonna start off now with the keynote by our chair, Brother Mitchell. We'll then have a presentation with Sister Fatma and Dr. Johnson. I will then do a brief walkthrough of our social platform. We'll then have some presentations by community stakeholders, and then we'll have plenty of time for Q&A, inshallah. And then we'll wrap up and explain next steps for our project. So without further ado, I'm going to briefly introduce Brother Mitchell, and I apologize, I will not be able to do justice to all that he has done, but just a few key points. Brother Gregory Abdullah Mitchell is an attorney in the state of Illinois. He's chairperson for the Leadership Development Institute and a board member of the Masjid al-Taqwa. He has served on the board of and provided legal advice to all kinds of organizations, Muslim and otherwise, for the last at least 25 years. Brother Mitchell is also a leader in the Council of Islamic Organizations of Greater Chicago. And we are very fortunate that he was able to join us and share some thoughts with us. Thank you, Brother Mitchell.
Assalamu alaikum. Well, I'm honored to be among you all, particularly in this trailblazing enterprise to, as Brother Saifullah mentioned, bringing health equity in the community, not only the Muslim community, but how that can spread to the region in which we live. As some of you know, first to clarify, I currently serve as the executive director of the Council of Islamic Organizations. And in response to the the social injustices we have witnessed this past summer, particularly with the death of Mr. Floyd, it more or less serves as a catalyst to put at the forefront the need for us as a community to fight for social justice. And clearly, in fighting for social justice, as Brother Saifullah reminding us, there can, without a component of that social justice, there needs to be health equity. And when I look at this particular project, the P Corps project, it is bringing the opportunity for diverse elements in our community to come together, to collaborate, to share resources, and to share information for the betterment of us all. It is giving that, adding to the new direction and vision for healthcare, that it brings all the people to the table to discuss how we can better advance the general well-being of us all, whether not only our physical health, but our mental health as well. We at the council also find a complete alignment with this particular project. And Sister Nancy Romanchik is online with us, and she's leading our effort to establish community nursing. And the reality of it is we're using a different name to reflect the same purpose that we all need to, that we all must reach out to various elements in our community to understand the challenges that they face on whether a health or mental level, and how we collectively can help uplift all segments of our society. So I applaud this effort. I look forward to be a partner with you in any way that I personally can to advance this. And inshallah, may Allah guide and reward all those who are involved, and inshallah realize the vision that you have set before us. Assalamu alaikum.
Wa alaikum salam. Thank you so much. Thank you so much. I think actually we might have a surprise and also very esteemed guest. Dr. Sultana, are you there? You might be joining us later. Not here. All right. So I think, yeah, probably we'll hear from her.
Can you hear me now?
Oh, we can hear you now. Yes, thank you.
Yes. Assalamu alaikum. I'm Dr. Aisha Sultana. I've been in this country for more than 50 years, about 50 to 53 years. And I'm connected with the Muslim Community Center. I've been on the board and member for almost my life. MCC has been here since for 50 years now. And that's one of the first centers that established the Health Awareness Committee from the beginning. So there were engineers and doctors who arrived here first. So we thought about that too. And we used to do education programs mostly first, because we are a very diverse community we have from different, this is the oldest masjid, and everybody who came to Chicago would come to MCC first. So we had people from all over the world. And we have seen many people who with insurance, without insurance, rich and poor, everybody. So alhamdulillah, we have been serving this, but without insurance, we were not able to give them, like the program is saying now, the equity was not there. So after that, with the help of Compassionate Care Network, who are the doctors from MCC only, thought about getting this some program that we can find out the people who don't have insurance and help them. So I won't go into detail about Compassionate Care Network. You can ask me if you have any question about that, what we do. But we do screenings for people, blood pressure screening, blood sugar screening, their weight problem, because these are the very most common conditions. And that gives rise to many other heart problem and stuff. So we started with that, and we still do it, and it's very, very popular and liked by people. And if they have problems, we connect them to a doctor. So we give them a home for medical care, and these doctors see them as private patients, but with very little charge, just like $25 or something. So we have been doing that for probably about 20 years. And now, because of the pandemic, we have stopped that, but we are continuing with Zoom education programs. Recently, we had about breast cancer awareness. We had about colon cancer awareness. Yesterday, we had the organ donation program. So we're doing that now. So I was the chair for the MCC Health Awareness Committee, but right now we have some other people, but unfortunately they were not able to join. So I will give them the message, and inshallah, Dr. Lat and Dr. Omar may be handling this after I give them their details about this. So I'm here to learn more, and if you have any questions. So alhamdulillah, I'm very interested in this equity of healthcare, because I'm seeing that firsthand. So inshallah, we'll work together.
Thank you so much, Dr. Sultana. We are really blessed to have you in our community. I didn't get to say this before you started speaking, but Compassionate Care Network, your work with MCC are all legendary, and we can learn a lot from you. So thank you for.
I'm a legend too now. So we have alhamdulillah young people that will be very good, and I'm very happy with that progress now. Okay. Thank you.
Now we will be actually starting our first presentation. That's going to be given, the first part by Sister Fatma and then Dr. Johnson. Sister Fatma and Dr. Johnson, I'll go ahead and share my screen, and you can just let me know when to move the slide.
Assalamu alaikum, everybody. Thank you. Action.
Go ahead.
Okay, perfect. Okay. The challenges of online or virtual, still learning quite a bit. Okay, so I'm so honored that all of you have joined, and it's such a pleasure to see everybody and community members. Pretty much every single person who's on the call today is really is doing quite a bit for the community, and you're all very actively and heavily involved, and that's what makes you be here. So my hearty thanks and for the trust and for the encouragement and for the for adopting the mission of patient-centeredness with us. Thank you again. This is I'll just start with a little icebreaker, I want to say. Thanks to Dr. Johnson, who got me to the habit of ice breaking. So fulfilling the market demand or the market need, I would briefly talk about simply the business of community health. Now, community health as a business, that's what my focus is today. Why should we be involved, and why should? So I won't take much of your time. It would be a little primarily a bit of introduction. So fulfilling the market demand, as you see in this particular picture, you know, all of us would like to do things, and we think that we are trying to do what's best for the community because we bring this out, but maybe that's not what the community wants. And so I thought that this particular cartoon really very well to what we need to sell for community health. So if I can have the next slide. I want to talk about the investments and the liabilities, the basic equation, investment and the liabilities that goes into as investments and create the product line or the programs and what comes out of it. And so who are the owners? Who's making the investment? Who's cashing the profits? And what are the assets? What are the assets and what are the liabilities of our community, of this particular equation for community health engagement? If we have the next slide. Next slide, if we can. So, who do you think is the owner in the community health equation? And this particular health equation is basically assets minus liabilities equals owner's equity, right? So who is the owner in the community health equation? Is it the president of the organization benefiting from the network? Is it the person who has the actual idea? Who's the owner in the community health equation, right? So is it the person who donated the highest amount? Or is it the person who controls the community, the project sponsor or the project manager? Who are the stakeholders? Is it you? Is it me? Who is it? So that's the question we have, the biggest questions we have in the business of community health. So if we have the next slide, we'll show the owner in the community health equation is actually the community. So it's the project, the program, and the ramifications, all of that, the community owns it. The community owns the project, the community owns the program, and the community also owns the ramifications of actually either having the project or not having the project. So if there is something that's missing from the community and we as community have not taken the responsibility, we're also going to have the ramifications of it. And we actually see it in terms of policy. So how do we actually balance the community health equation with respect to assets and liabilities, and how do we move forward? Okay, can we, if you have the next slide. So the question is that we have an assets, we have the liabilities, assets minus liabilities turns out to be owner's equity, right? So with owner's equity, how do we maximize it in the community health setting? We all know liabilities decrease owner's equity and assets increase owner's equity. Nabil, if you could just have a little animation in that. So this was so if you keep clicking, the next slides is actually should go ahead, go to the previous slide. Yeah, right here. Okay, so assets minus liability equals owner's equity, right? So assets increases and liabilities decreases. We know that. So we got to have so we need to understand what exactly our community health need is, because that need and not having the program and these kind of health inequities are the biggest liabilities in our community health. And these liabilities are really eating up our assets. And these are the assets which are the positive resources in our community, or the resources in our community. And that is part of the reason why we are going toward asset mapping. So the owner's equity really demands having the real needs, an understanding of the real needs, and having the smart solutions in order to bank on that owner's equity, or in order to have positive owner's equity. So what happens if we have too many liabilities, it'll eat up all of our assets, and we actually end up with a health disparity, which is the negative owner's equity. That's what the health disparity is really about. It is the negative owner's equity. So we want to create our assets in the sense that it absorbs the liabilities, and we have positive owner's equity, and we are looking for positive health disparities. So let's have the next slide, please. So we need to determine what exactly the real needs are, and we need to have a smart solution. And a smart solution, and between these two, it really it results in a measurable impact. So if we can go to the next slide. Now, this is a very interesting slide that actually came up out of, this slide is actually a result of 5 years worth of community health work. There are perceived needs and there are real needs. So just the same way that those kids are trying to sell these books, and the much older gentleman there is trying to sell the ice cream, and where they're thinking, what exactly are we selling here? So the perceived needs and the feel-good solutions, and we have a perceived need. We actually design a solution. Somebody cannot get in, Masood. We have a perceived need, and when we design a solution which makes us feel good, it's really, what are we doing? Fraud is a very high, it's a legal term, I totally get it, but really that's what's happening. If you put resources on a perceived need, you put resources on a feel-good solution, that is waste of resources. And in community health terms, when it's the taxpayers' dollars, it's literally, that's what it amounts to. Versus if you have the real needs and you have a feel-good solution, so the need is real, but you have a feel-good solution, you don't have a smart solution, that ends up as a disaster. When you have a perceived need and you have a smart solution, it's a bubble. We are living in a bubble. And if you have the real need with a smart solution, that's the only time when you have a success. So I'm a very heavy advocate and proponent of defining the real needs and matching them up with the smart solutions in order to have assets minus liabilities equals to positive owner's equity, and that's what we are looking for. So again, this slide came out of the studies that a lot of us are having. We see that we have a lot of programs in our communities, but guys, we've got to have real needs that's measurable, and we got to have smart solutions that we can, and then when we meet the real needs with the smart solutions, that's when we have actual success. So we've got to be, these needs, the community health assessment needs must be measurable. The smart solutions or the community health research impact has to be measurable. Both of these has to be measurable, and that's when we get this success. So that, with that whole idea, we embark on this project of community health research engagement, where we want everybody to come in, define the community health needs assessments, and define those smart solutions with us. We are nothing without the entire network. So let's move on. So what are the social determinants of health? And I want to, at this point, I want to tune the folks in to the social determinants of health. We talked about the social justice. We're talking about the equities. We're talking about the underserved markets. So the government actually has defined a lot of these things, and we all need to tune ourselves with the policies that exist. We need to, our efforts, our smart solutions need to be in line with what the government policies are, with the work that's going on in the government sector, in the Department of Health and Human Administrations, in the Center for Medicare and Medicaid Services, and the CDCs, the Center for Disease Control. They're umbrella organizations, health organizations run by government, or health departments run by government. They come up with health priorities. They come up with the social determinants of health. They define these metrics for us already. And all of our projects, no matter what we are doing, we need to line our measurable goals with these core measures that goes back to measuring social determinants of health. And that's how we measure our impact. So this, but I have all of my slides, wherever I borrowed this on, they actually have the resource. I would request everybody to go into the actual resource, look through there's a lot of materials out there, look through those and align your programs with those. You can also join with us. We are putting ourselves or aligning ourselves with Healthy People 2030 goals that is set by CDCs. There are 5 social determinants of health: healthcare access and health qualities, neighborhood and built environment, social and community context, economic stability, and education and access and quality. Now look in here, medications are not on this list. Primary care services are not on this list. Eye care is not on this list. Water quality is not on this list. They're all bulked into one of these categories. And for example, clinical care is bulked into healthcare access and quality. So we all have to work together, join together, and make sure that that access to healthcare access and quality has a considerable impact, through our project, whatever we do. So if I can have the next slide, we will actually see how this actually measures. This particular diagram, actually, I will put the reference in there. This came to me through Dr. Rebecca Johnson, who actually got it from Robert Wood Johnson Foundation's research work, and it's talking about the 70% of the health inequities are actually impacted directly by health behaviors and social and economic factors. So if we look at it, health behaviors contribute to about 30%. Clinical care, which includes access to care and quality of care, it amounts to about 20% of the total health inequities. Social and economic factors, 40%. And physical and environmental factors are about 10% of it. So altogether, if you look at it, and align your project up is one of those basic factors, you would see the kind of impact your project is making onto the health disparity. And that's where we need to line ourselves. If I'm spending 60 hours of my time on impacting a health disparity, I would like to see a major impact through clinical care as well as through social and economic factors. So if I combine the clinical care and social and economic factor, that's 60%. So my 60 hours of week work is going to go in to create a major impact. I can be sure about that. And that's how we line our projects up. So our next slide. And again, this particular slide also comes from the CDC's website. Again, this is 2030. That's where we have aligned our project to that goal, Healthy People 2030. And if you look at it, the community-based organizations are a big part of it. So there are physicians, there are state and local governments, there are community-based organizations, there are individual stakeholders, key stakeholders at the grassroots level. They are the major sector that needs to be where this impact happens. So they need to be equal partners with us in all of our projects. And that's the push with the grassroots level. And that's why we are taking this project to the mosque communities. We're taking them to the community-based organizations and trying to have everybody pool in their resources to help dissipate the health disparities. So if we can have the next slide. One of the examples that I would like to give out as one of the partner organizations, Imana actually helped. It donated $15,000 for this year of 2020 to actually assist the eligible folks with their healthcare cost. That translated into 35 individuals, over 20 families, to meet their entire worth of healthcare needs. And that is as a community, we are saving $350,000. So out of the 15,000, the savings are 350,000. And this happened because not only because what we are doing, but because Imana partnered with us. They provided that kind of input, and we have partnered with Imana as well to provide our effort to make that kind of big impact. So this is a measurable impact. The Family Assistance Fund, we are looking forward to having assistance from different organizations as well, and possibly making a much greater impact. This particular Family Assistance Fund is basically the same model that you may have heard about Access DuPage. So Access DuPage is pretty much having the same model where they help out the community members, but it's only for DuPage County. We actually took this funding from Imana. We took the model from DuPage County, but we started to help out. The people from Will County, Cook County, McHenry County, Kane County, because those counties do not have a program like Access DuPage. So, or DuPage, I believe it is called Access DuPage, where they are helping out with the healthcare costs. So thank you, Imana, for one more time for assisting and saving the community $350,000. The next slide. So we actually took this entire approach of patient-centeredness, and we actually, as Nabil have pointed out, the Initiative of Islam and Medicine, Dr. Padela's organization, and Dr. Paris Davis's organization, Pastors for PCOR, has joined hands together, and we are actually trying to have a bigger asset portion to overcome the liabilities of health inequities, to actually have a higher stake for the owner's equity. So go ahead and move forward. Both Islam and medicine, actually, I would like to, this is a surprise to my team as well, because I saw Sundus joined from the IAM. She's the secretary of the Initiative of Islam and Medicine. As you probably know now, Initiative of Islam and Medicine is actually now an independent or not to, and it would now in a position to literally go as far as Allah subhanahu wa ta'ala will take it to, and make that huge impact on in the field of bioethics, which is a very important and a key factor in the decision making when it comes to disparities as well as health literacy at an individual level. So I actually see, and I would like to literally, I see Dr. Padela as the father of Islam, Islamic bioethics. And I'm very sure that in 200 years from now, he would be known as the father of Islamic bioethics. May Allah support his vision, and may Allah help us to support him as well. So I would like to, I wanted to have one more addition to this whole idea of Islamic bioethics. In fact, it was his vision about 3 years ago that he put a project together for pcori.org, and where he pioneered the patient-centered methodology with Islam, with the mosque-centered or mosque communities mindset or approaches, and he put the two together, and he came up with this with the eMarch project. So he trained about 15 organizations in the previous eMarch project, which I probably have a slide, Nabil, after this. So he actually had, yes, so if you go to the pcori.org research results, and in 2017, this project was funded by PCORI, and out of that particular project, Engaging Muslim Americans for Research and Community Health, eMarch, we put together a mosque PCOR toolkit, and it was the mosque PCOR toolkit that allowed the funding for this particular project, and this is the toolkit that we are disseminating in the mosque communities, but we are disseminating it from the patient-centered perspectives. So we have trained the cohort of 10 community health workers, and Nabil would tell you more about them a little bit later, where we have taught them the mosque PCOR toolkit, and along with the patient-centered methodology that is the methodology of PCOR, Patient-Centered Research Institute, and with that mindset, these folks are trained to actually help the community with the existing community assets. And Dr. Johnson would actually introduce with you the idea of community resource and community assets, and how all of these factors are coming together for making a difference within making a difference and actually dissipating the health disparities within the mosque communities. Alhamdulillah. So we have this engagement is coming out beautifully. There are too many variables. I totally understand, and probably at this point everyone is very confused. Yes, and you should be, because community health is not an easy thing to understand. I started making sense of community health after 10 years with the foot on the ground at the grassroots level. So, and I actually literally worked with the community health research parties for the past 5 years, and that has now started to make sense to me. So we have many pioneers in our organizations. Actually, CCN is one of the compassionate care networks. We take them as our mentors. Initiative of Islam and Medicine, Dr. Padilla, he has been mentoring us, and we also have some other folks now. Dr. Abdullah Michel is really, when he speaks, he may not have seen the PCOR methodology as yet, but he talks and walks PCOR methodology. And PCOR methodology literally has come out from the people who have pioneered the community health efforts for past 50 years. So many people, their lives have gone into this discipline, and we're a generation that is actually riding on their shoulders, and we are indebted to these organizations. Many, my hearty thanks goes out to all of them. Thank you so much. Nabila, if I can have another slide, the next slide. And before we move on to this particular vision, I would like to have, if Sundus would like to say a few words about the programs of IIM, I would like to give a few minutes to Sundus. Sundus, would you be able to do?
Assalamu alaikum, everyone. Can you guys hear me? Okay, alhamdulillah rabbil alameen. Thank you so much, Fatima. This was very informative, mashallah, especially I think the balance of how you can actually accomplish community health programs. Jazakallah khair. I'm so glad that I actually got to see the invitation to learn all of these things. I'm fortunate, alhamdulillah, that I got to meet Initiative of Islam Medicine in 2018. And I strongly believe in this, that I was willing to get involved at a formal level, as probably most of the people that are on this platform are involved in many associations at different capacities, but to be formally involved where you are dedicating your time to an institution like Initiative of Islam Medicine is really a big deal. It's a huge amana. So for now, Initiative of Islam Medicine is really the baby of Dr. Asim Padilla. And it is called the initiative because really the steps following this are plenty. We're just kind of initiating the facts, initiating the efforts that would really reroute the public funds and the tax money of Muslims into their healthcare needs. And that's something that has been overcome for a while. It is data driven, so it really caters to the conventional medicine and healthcare needs. I think Initiative San Medicine has established, I think, the concept of PCORI for a while. And everybody, I think that's how we all converged and met on the path of Initiative San Medicine, as there were so many people like Fatima that we have to provide data, and we need to figure out if the patterns in the Muslim communities are proving themselves to be consistent despite the heterogeneity of Muslim communities. Just to be brief, I think now Initiative San Medicine is working on the Muslim American health experiences, needs, and preferences. This is a study that is ongoing. It doesn't have any funds as of yet. It's not attached to a grant. It is nationwide and probably can be international if a Canadian team is secured. It works on pretty much the concepts or the core values of PCORI. So it's like a community-based participatory research where people are, we're forming through Initiative San Medicine regional teams, people disseminating the survey to explore the experiences of Muslims, American Muslims in the healthcare system, mostly in the inpatient settings. And we are targeting like the places like free clinics or masajid where we can reach out to Muslims. That's one. Welcome actually to share any opportunities to find fundings for that. That's a very big study. Thus far, I think we have over 9 states, 9 regional projects. In each state, there's more than one regional team. There's of course the EMPART that Fatima has delineated very nicely a minute ago, and there is the still the internship program for students that has been on hold for a while until like Dr. Fadila kind of settles down for scholarship and mentorship. In the long term, hopefully bioethics curriculum that can be shared with academic settings is the really one important goal. And the ultimate future planning for Initiative San Medicine is to have a bioethics department in the academic setting led and directed by Dr. Fadila, where people can actually earn certificates and degrees and disseminate that knowledge throughout the Western world, specifically North America. Correct me, Fatima, if I have missed any of the major things. And alhamdulillah, Dr. Fadila has his book is coming in June 2021, which is the Medicine and Sharia. If you guys have not used the code to buy that book, please let me know and I'll share the codes with you guys. I'm using the platforms for marketing shamelessly, because definitely whatever Dr. Fadila is writing, I would always like to read. As I do agree with Fatima, he will inshallah be deemed the father of Islamic bioethics in his time. And may Allah grant us the strength, patience, and perseverance to follow the steps and introduce more into the gaps that are missing into the Muslim health care provision in the US and North American world. Thank you so much for allowing me to speak at a short notice.
Many jazai khairan, Sister Sundas. Many.
I think we will now turn the floor over to Dr. Johnson, who is a longtime community health researcher with a special focus in aging, and she's also been a great collaborator and partner with our project. Yeah, forward to hearing from you.
Okay. Thank you very much, Noel, and thank you so much for.
I would like to invite Dr. Johnson. Nabil, do you want to introduce her?
Were you able to hear me, Dr. Johnson?
I did. No, I heard you. Don't worry. It was a nice. Thank you. It's a very nice introduction. Thank you.
Course, sure.
No worries. Yeah. So yes, thank you so much for inviting me here today, and it's been a pleasure. I've been working with Fatima and the Worry Free sort of community team on the training program that precedes today, and so Fatima asked me to talk here about how adopting the PCORI research principles sort of lead to a smart solution for community needs. So going back to the slide Fatima showed about with the smart solutions, it's basically, I wanted to introduce you to the idea of the PCORI vision and also share with you the experience that myself and the leader of a program, Pastors for PCOR, Dr. Davis and Dr. Ingram, have had developing a training program previously for faith-based communities, mostly Baptist, for Baptist churches. So I want to give you these sort of concepts and the principles, but also give you some real examples of the benefits of doing this work. Because as Fatima said, it can be very, there's a lot of jargon, there's a lot of terminology, and yeah, I think it's taken me 10 years to really get my head around everything too. Okay, so PCORI, well, perhaps let's start with what does that stand for? So that's the Patient-Centered Outcomes Research Institute, and it was set up at the same time as the Affordable Care Act. The idea was that there would be an institute which could do research which would match the expanded sort of vision and view and of the sort of the world that the Affordable Care Act would open up, so that there'll be less. The idea was there'd be less disparity, and that we would have the research which would match the sort of America that the Affordable Care Act was sort of serving. So all of these principles came out of how research should contribute to reducing health disparities, and fundamentally, put very simply, engagement in health research within the PCORI world is all about bringing stakeholders together at the table who've not traditionally been involved in research. Now, this is again where the terminology gets a little complicated. So the word stakeholder is not a particularly user-friendly one, and they talk about patients a lot. Now, when they talk about patients, they are talking about people's experience of the healthcare system, but they're not excluding people who don't have access to the health system as well. So a stakeholder is basically, it could be all of us. It is all of us, really. So the point is that we go from this little chap on your left. He's sort of, that's the old style researcher. What do I think matter? And then that sets up the question, and then the researcher goes off and answers the question. What PCORI wanted to do was move us all to so that we were all sitting around the table. We were all sort of equal, all had equal voices around the table, and ask the question, what matters to each of us? And so I've just given you an example of some of the stakeholders that PCORI basically has named, really. And as a result, whenever funders name people within groups, they become a priority area for funding. But so caregivers, researchers, patients, and community organisations like Worry Free and Pastors for PCOR. And I'll say a little bit more about that. So if you have the next slide. So yes, so I work with Pastors for PCOR. I'm a sort of independent researcher, so I do consultancy work for Northwestern University, and I had 10 years of experience working there, but I've gone freelance, and I work as a consultant for Northwestern University, and I also do community engagement work, and that is for Pastors for PCOR. And I just want to say a little bit about what we've done. We've worked together. Dr. Davis is the community lead. So this is a project which is led by a community group. It's an engagement project which is led by a community group. Pastor Pico, which comes under the umbrella of Total Resource Community Development Organization, and I'll say a little bit more about what that organization does. But it's basically Pastors Pico was set up as a community lead, so that pastors could sit at the table and say, this is what matters to us. You know, these are the health issues that matter to us. And so our mission was to build a partnership of faith-based communities, researchers, and other stakeholders to work together to create programs for community members supporting health and well-being, very much in line with what you've already heard earlier on. So the focus is really working together to create programs which address issues or identify issues and then address issues which matter to community members. And we have been funded by PCORI we're on our third engagement award, and we started off training a group of what we call research ministry ambassadors in how to do a survey to identify the priority conditions within the community. And it's a network of about 12 churches initially. So very similar. There were so many parallels between what we were doing and what Fatima had and Dr. Padella had envisaged, that we felt it was useful. It was a natural partnership for us to get together and sort of work together and think about how we could transfer lessons learned from what we've been doing, and they could be adapted for the mosque community. If you have the next slide. So TRCDO, just to give you, Pastors of Pico is not the only thing that Dr. Davis is doing. She's an amazing leader, and myself and Dr. Ingram are sort of the scientists with the research bit of this. Dr. Ingram has an amazing background in clinical research. I'm a social scientist, so I do more of the sort of social and behavioral type of things. But Dr. Davis leads this amazing organization called Total Resource Community Development Organization, which is a 501c3 attached to a church, Tridestone Full Gospel Baptist Church, which is led by Bishop Simon Gordon. And it's his vision really that sort of got this all going. None of this could have happened without him or Dr. Davis or, you know, the amazing, I mean, Fatima said it takes, you know, it's everybody's involved. This doesn't happen on its own. It's a really team, network, everybody working together. So this gives you an idea of what TRCDO has been doing over the years since sort of 1999, and also how Pastors of Pico has sort of fitted into that later on. So it's about research engagement. But Bishop Gordon felt it was very important to be able to sit down at the table with a health researcher and have that conversation about things that mattered to the community. So if you have the next slide. Yeah, so who are we? So yes, I just briefly said that. I've got this slide because, as I said, I really do want to emphasize this. This is sort of, it takes a village. It takes a village to deliver this work. And it's hard work. It is hard work as well, but it's very rewarding. And also, I think Dr. Davis, and Dr. Ingram and myself, we were sort of the three musketeers down in the bottom. We sort of, yes, we've sort of learnt a lot as we've gone along, and I want to share some of the gains that we've got. And the research ministry ambassadors, so here is Pastor Barbara and Priscilla Brown, both from different churches. They were part of the training, and I think they would agree they've learnt a lot as well. And this is Bishop Gordon on the other side with Regina Grace Smith, who was very much instrumental in sort of saying she was being a PCORI ambassador and was very much a bridge between us and PCORI. You have the next slide. Okay, so why work together on research? It's not actually an obvious partnership between a service provider and researchers. It's not obvious at all. We had a lot of discussion about this, and we might, at the beginning, we may not have even gone there. We felt we needed to have the discussion. So Pastors of Pico, we decided that there was value. I will never forget the day that a group of about 12 bishops, pastors and elders came to Northwestern and sat round the table and we all talked about why should we do this? And so we came up with this. there's value in matching conversations to congregants' interests that lead to education. The focus very much on education. And informed congregations lead to greater levels of health awareness and education. So, and I think I think Fatima and the team in the process of also thinking about why work together on research, why suddenly learn all this new lingo, this new language, why get involved? And it's a good question. And I think it's an ongoing question, which is really useful to keep asking. And Fatima was feeling that at this point, similar things, there's value in matching conversations in mosque communities to mosque communities' interests that lead to education. And again, informed mosque communities will lead to greater levels of health awareness and education as well. So that understanding and that knowledge is a very good way of overcoming this sort of the structural barriers sometimes, because which can sort of prevent people from actually accessing it. If you know the questions to ask, you're in a much more empowered position. And one of the images that we've been using a lot during the training was this idea that we're trying to move the needle a little bit away from the mainstream to the grassroots. A lot of research tends to be focused on this end of things, the major newspapers. You'll see reports in the New Yorker or the sort of New York Times, or and the government data, that's Fatima saying, policy data is important, yes, but it doesn't tell you about the lived experience. It doesn't tell you how somebody's experiencing a policy, and often it's when they're experiencing a policy that we all realize when the gaps are and where the bits weren't thought through. If you have the next slide. So how? So there's the why and the who and the how. So the how is engagement. Picori says engage. Now, what does it mean by that? So it recognizes that the following components are major elements of an engagement plan, of a stakeholder engagement plan. As I said, the word stakeholder can mean community organization, it could mean patient, it could mean advocate, it could mean payer, it could mean insurer, it could mean clinical organization. But it basically, stakeholder engagement must reflect a bidirectional flow of information. So it can't just be, expert researcher telling everybody what's good for everybody. It has to be also listening. So there's that whole sort of listening. We need expertise. That's very valuable, but there needs to be a sort of bidirectional flow of information. It needs to be the whole research process and engagement and talking about what matters needs to be done along principles. There should be a continuum of engagement. So there's a sustainability plan in there so that, because so often research is limited to a couple of years. Collaboration or shared leadership is really important, and stakeholder groups must include most of the categories of Picori stakeholders. But if I don't want to take up too much more time, but if I can just sort of focus on the principles, the engagement principles, and have the next slide, Nabil, thank you. So these are the principles: reciprocal relations, co-learning, partnership, transparency, honesty, and trust. And that number 4 is huge. That's a really, really difficult one, but so important. I think everything else follows from transparency, honesty, and trust. And I do have to say that sometimes researchers are not very transparent about why they're doing things or the finances behind research. And so these things are very important. So the open and honest communications is particularly important. And they've got that number 4 has become even more important in the time of COVID as well. In the sense that we're rushing, we're wanting to see a vaccine, we want to see protections, we don't, but these things can't be rushed. They have to be sort of thought through carefully. So just to conclude, if I can just sort of the next slide highlights the factors which we have found are necessary for effective relationships. Good communications, absolutely crucial. Teaching one person to reach many. So this is the group of the first RMAs, Research Ministry Ambassadors, who graduated. We have a manual, we have teaching materials which we could share with the Pastors for Peace or the Trust, and understanding about the ethical behaviours and the rules guiding researcher. Ethical behaviours were absolutely crucial. We were not going to move forward until people felt comfortable that research was an equitable exercise and an ethical one. So we talked about the Belmont report, we talked about pledges, we talked about parts people could play as partners, and the guiding principles were being informed, having respect, and working together. Good communications throughout that, absolutely crucial. So just to give you a whistle-stop tour to Pasos Pico, we've also we've worked together on many project posters, and I think particularly Dr. Davis, posters. It was very funny because we were working on these, and Dr. Davis says, "Isn't that something that's something you do at school?" But in the research world, posters are very important. They're a key way of explaining science, and so we have tried to do that. We've tried to explain science simply and the project in terms of what we're doing. So if you have the next slide. So basically, what's the gain? So the gain for us has been the partnership coming together, bringing together lots of people around a table to address what matters to faith-based communities in the south side of Chicago, Baptist, predominantly full gospel Baptist churches. We've done that across Chicago. You can see a little map there showing you the range. And we've also, some of the outcomes, sorry, that's not very clear, but these were what the research ministry ambassadors told us they wanted to do. We trained them to do a survey to identify priority health conditions. And then people said, actually, they enjoyed doing that. They'd like to do another survey. That was one of the things. And it was so we did, we developed and administered a survey. If you have the next slide. You can see we did the survey. These are the results. We had a method. We identified priority health conditions for the Chicago churches who took place, and then we took our work and did it in Arkansas as well. So we came up with some priority health conditions and some priority health factors. And then finally, the last slide is I wanted to sort of highlight this one for you. The next slide. This one, because how would you we were asked at one poster session to explain how we would describe the importance of our work to a lay person with no background in population health. And so I think this sums it up quite well. So historical mistrust resulting from evident racism, discrimination, and bias is a key reason why underrepresented people and communities of colour have negative perceptions of research, medical institutions, and researchers. So a partnership of faith-based communities, health researchers, and other stakeholders work together to create a survey and training programme for faith-based community members. The aim was to build the capacity of faith-based communities to engage as equitable partners in health-related initiatives and build trust through improved knowledge and understanding of the survey process. So that, I think, sums it up very well. And so we are now at this point where we are a community hub. So the next slide is the last slide. And so this is where we are. So Dr. Davis is leading the Community Support Hub, which is Pasos Pico, and it's connecting patients, stakeholders, and researchers. And obviously, our partnership with you is one of those connections. We've also got a partnership with Northwestern, which is funded by the National Heart, Lung and Blood Institute, and that's with Dr. Coe, the Centre for Health and Information Practice at Northwestern. So this is where this has all led to. So that's the story of the engagement. That's our engagement story, and I hope that helps you to understand PCORI as well. Thank you.
Thank you so much, Dr. Johnson. We are running a little bit later than our agenda, so we're just going to modify a couple of things. Actually, I was supposed to present next on our social engine, and I will do that. But before we do, just because we have a couple of community stakeholders, and I want to make sure we give them enough time in case they have to leave. I want to sort of now turn over to, I think, Sister Jugnu from ISNS. Jugnu, are you there?
Can somebody unmute her maybe?
So I'm not able to unmute anybody, but I don't know if Bilal or Masood.
What's the last 2 digits of the phone number?
92.
It won't allow me to do it either.
It's 92.
Yeah, I got it, but I'm unable to unmute her from here either.
Brother Omer from MCC, are you there?
Hello, are you able to hear me?
Yes, thank you. I don't know if it's okay to have you just speak for a couple of minutes from the MCC perspective.
Yeah, I mean, I'll just introduce myself actually more than anything, and then inshallah we can continue this conversation at a later point as well, because I'm kind of on here by myself at the moment, and the other chairperson is Ishaq Lat, who was not available to join us today. But assalamu everyone, and as Dr. Aisha Sultan had mentioned early on, Ishaq and I have been working as the chair and co-chair of the MCC Health and Awareness Committee. And so as far as programming goes, we joined as committee members, I would say a few months ago at this point, and have just kind of been planning to provide health, again, kind of ongoing health education resources, and whatever it is that we can for community members, and especially based off of requests that are made by individuals in the community. And so, one of the things that we did is we've become a bit more active via social media, because we are seeing that a lot of people are really gaining information from those platforms. So if anyone does have some time and wants to check it out, at MCC Health Committee is an Instagram page that we had started. And as Dr. Aisha Sultana had mentioned as well, we have done a couple of discussions so far on mental health, breast cancer screening and awareness, colon cancer screening. Yesterday we did one on living organ donations, and that's something inshallah that we'll post up later as well. I did fortunately have a chance to speak with Sister Fatima and Brother Masood as well recently, and so inshallah we'll see how we can maybe work together in the near future. And I appreciate you all inviting us on to gain a bit more information as far as what it is that you are looking to achieve. And inshallah, we'll see again, as mentioned, how we can potentially work together in the near future.
Great, thank you so much for sharing that. I'm told that Sister Jugnu might be able to join us now.
Yes.
Hi, Assalamu alaikum.
Can you hear me?
Yeah, we can hear you fine.
Okay, all right, yeah.
Thank you for joining us.
Oh, no worries, sir. I'm Jugnu Khan from ISNS. So let me give you a little brief what I was doing over there. So it's been 30 years I'm involved with ISNS, and then with lots of shelter home, and then ARA as the American Asian Retired Association for 10 years. So this I'm very happy that ISNS and Worry Free is joining now. The work which Fatima and Ruj has done, the Worry Free people, is very good, very fantastic, and we are very happy that we are together. In future, whatever they want to do something with ISNS, we will be very happy to join this Worry Free program. So is there any question anyone would like to know? And it's something about ISNS, because I think it's in the what everyone knows what ISNS has done for the past 39 years. We do the leadership classes. We do lots and lots of on Sunday. We have a health screening. Every 3 months we do the health screening, and we do leadership classes and any community work, like even during the election time for the past all these years. So we are completely involved with that also. We have a very good senior program, and there's a lot of things which has been, because this is one of the, after MCC, ISNS is the one. So we are coming up with more. Now I am retired, but the young children, they are doing a great job. Very proud of them, as Fatma Rahman and Uruj. Like these new girls, and the new generation is coming up, and they are doing a great job, fantastic job. They have very good ideas and all, brainstorming and everything. So I think that's about it now. I'm retired, enjoying. So any question that you would like to know? Yes, Uruj, Fatma.
Thank you. Many thanks for coming and sharing your thoughts about our projects. Thank you so much. And ISNS, we have it has been independent, and we've done quite a bit of programming out there. You have lots of resources, and we are hoping that all of these lost communities that are having these resources, we can share this among each other. Not only share this among users, also share it with other communities outside. So we leverage our positive assets to take away the liabilities in the general community, and thereby eliminating health disparities across the board among all communities. So I'm really, really proud that we are putting together our efforts to actually take care of all the communities across Greater Chicagoland area. Inshallah, may Allah bring this to fruition for all of us.
You are doing a great job. Very proud of this new generation, Fatma. You all are doing a great job. Keep it up. And is there anything I can do from ISNS or from ARA, anywhere, just let me know.
We sure will, Jignat. Thank you so much.
Okay, but all of you take good care. It was very nice talking to all of you. So, you all are doing a great, great job. Very proud of the new generation. Okay, Dr. Davis, and I think there are a few people over there which I haven't met them. Maybe in future I will.
Hopefully soon.
Okay. Yeah, okay. All of you take good care. Okay. Okay. Assalamu alaikum. Okay. Okay. Take good care. Okay. Salam. Okay. Khuda. Khuda Hafiz.
So,
Assalamu alaikum. Thank you so much, Ignati.
Oh, yeah, no, because you all are doing a great job, Janu. Can I stay on the line? If I can stay on the line?
Of course you can.
Okay.
Yeah, our meeting is not done yet, so we have a few more minutes, so please hang in there.
Okay, I'll do that. Okay.
Great. So right now I've put up our contact information. If you since we are running a bit late, we'll run a little bit later if that's okay. But if some of you have to leave, feel free to contact any one of us listed here. If you have any questions, I didn't get a chance to introduce Brother Bilal earlier, but he's our programs coordinator. And if you are sticking around, please continue to send any questions that you have to the chat or to him, and we will address them shortly. So, Sister Fatma, if it's okay, I was just going to briefly at least show the website and a couple of things, and then finally, come to a close. So I'm going to share my screen again briefly. I'm just going to show our website and our platform, which will give you like a very clear, I think, illustration of how our program is actually going to work. So as Dr. Johnson mentioned, Sister Fatma, we have a wonderful cohort of about 10 community health workers who are going to be doing virtual outreach with their assigned community area. We have about 5 mosque community areas that we have assigned, and they will be creating an asset map, mapping all of our many assets that are health related, as well as helping community members with their healthcare needs, which sort of supplementing the worry-free community's work. So just to give you a sense of what that will look like, I'm going to share my screen again. So this is our website, worryfreecommunity.org, and there's a lot on here to explore. So I highly encourage you all to take a look at this, because I think this will also help clarify some of the things that we will be doing specifically. But if you scroll down, one thing is that we have sort of the section for each of the 3 big projects that Worry-Free is working on, and on the left is the EMPART project section. So if you click on the team, you'll see all the team members, and these are all the wonderful community health workers. So we haven't gotten a chance yet to introduce them on this call, but you have their photos, their contact information on here. And then if you go back to the main homepage, right now you can see that it says join our social platform on the right. But on the left, you'll see tabs for enroll now, since we are in the open enrollment period for healthcare. If anybody comes to this website and needs to enroll, you can click on that and fill out some basic information, and that will help us get in touch with you. If you're a community member who has an asset that we can list on our asset map, you can click on Be in the Map and fill out a Google form that asks you to, ask your contact information, as well as, what kind of service or your organization provides, and then any other information. And once you fill that in, you will end up on our asset map, which I'll show in a second. And lastly, if you're just interested in getting involved with the project in another capacity beyond just being an asset, if you click on the Get Involved link, there's a form for you to fill out. In particular, we are looking for help with our legal, communications, and data committees, as you can see down below. But we're really, happy to have, happy to work with you, whatever gifts you can provide. We really look forward to working with you. So lastly, just wanted to sort of show where 2 more things. I wanted to show the asset map at the end, but if you look to the right here, you have this little icon. If you click on it, it says talk to us. There's a phone number, and then there's also, you can just put in your name, email, and a message for what you need. So this is intended for community members who are looking to, whether it's to enroll in health insurance or if they have any other resources that they are looking for. Our community healthcare workers will be on this website, every day during the week, and they will be working to respond to these messages as they come in. Lastly, I wanted to briefly show what our asset map is going to look like. So right now, this is pretty sparse. We have a few assets on the right, Worry-Free Community, since some recent assets that we already know, obviously, but we know that there's many more. Those are being added into the asset map, and this is a searchable asset map. You can type in any term, and it's a pretty robust search tool. If you'd like to be, if you have an organization that would like to be included on here, please reach out to us. This is going to be, so this is like, I think one of the big projects that we are working on through EMPART is putting together all the assets. We know that there's all these organizations, individuals doing great work out there, but we want to sort of put everybody in the same map so that people know, what the resources are throughout their community. And sometimes there are resources that are very limited, or there's only one or two of them in the community, and it might be, not right in your neighborhood, but you should still be able to reach out, call them, find their website, things like that. So that's just a brief overview of our platform and our website, and also a brief insight into part of the work that our community healthcare workers will be doing in partnership with the mosque communities over the next few months. So with that, I'm going to stop sharing, and we will be coming to the close of our program. I don't know, Sister Fatma, or, if you wanted to say any few words on wrapping up and the next steps, or if Brother Bilal wanted to share any questions, either way we can.
Yeah, I think I have the close on also for work reach.
Brother Bilal, do you want to add a few words? We actually have the
Assalamu alaikum, sorry.
So if anybody who wants to take a look at the polls, and we're trying to coin a word for virtual outreach, so help us out here. And Bilal, do you want to close the meeting?
Well, yeah, I would like to first, sorry we're running a little bit behind schedule. My name is Bilal, I'm the project coordinator. We did want to have a question answer session with the community and see what everyone thought, and if you guys had any questions in regards to the social platform, you can read this on the website.
Everybody wants to go to the polls on the right side at the corner. There is a button there saying polls, and if you go there, we have a quick poll out there saying please select the word. Please select the word to be adopted for virtual outreach in this project. It's virtreach or voutreach. So we just want to have one word instead of virtual outreach. We want to say one particular. So whatever you guys decide, we would adopt that word. Thank you again.
I just wanted to say thank you all for attending the meeting. Jazakallah khair, and inshallah Allah bless this endeavor that we're going on.
Assalamu alaikum, and thank you for allowing me to join you. Assalamu alaikum.
It looks like our poll may not be working, so I think that's okay. We were going to send it to your into your email as a form, and if you could please take a moment to vote on that, that would be great. In the meantime, I'd have Brother Bilal maybe perhaps close the meeting.
Sorry, can you repeat that, Sister Fatima? I wasn't able to hear you. Hello?
I think, can you hear me, Brother Bilal?
Okay. I see Brother Masood launching the poll again, and it is live. So we just, I just voted on that, just in case if you guys want to vote on it.
Okay. I don't see it still. Poll.
Just so that I see quite a few people on the line, and there is a poll out there. So if you guys want to, if you want to, you can, if you want to go to the polls and take the polls, so it would show us. There are 7 people voted, but others are waiting.
Oh shit. Huh. This is weird. Is that? What's that? Ah, there it is. Okay. Let's see here.
No, I can't hear anybody speaking. Brother Nabil, if do you want to close the meeting?
All right. Yeah. If everybody can just fill out the poll again, and thank you so much, everybody, for joining us on this busy Sunday afternoon when there's a lot going on, elections, and just life in general. So we appreciate your time. We appreciate your support. We look forward to working with you all. Please reach out to us if you have any questions or concerns. Going ahead, we will have, just like a very early save the date, we will have a town hall event in March. That's going to be our next sort of big event. Over the next few months, the community health workers will be doing their work, making their connections, building their asset maps, serving their communities. And we'll, again, inshallah, have a big event in March. We will also be having monthly, for anybody who's here from the mosque communities, we will be having monthly check-in calls with each mosque community and the community healthcare worker. So that's the plan going ahead. Again, thank you for coming out, and I hope you have a good afternoon. And God, may Allah bless all of your efforts to make our communities healthier, inshallah. We'll leave the call open for a few more minutes if people want to ask questions or fill out the poll still.
Thank you, both of you, for putting this together.
Oh, yeah, thank you, everybody.
Thank you so much, Nabil. Thank you so much, Bilal. You guys did a great job. Thanks again. I really, again, obliged, and my hearty thanks to both of you for putting this effort in. And I know that at the last minute, a lot of things are pulling in at the last minute, and that's how it happens in community health. I've seen it.
Yeah.
Because people have so many things on their agenda as priorities, as soon as they or when they tune in, that's when you got to capture them. That's why I say that community health projects are like carving water. When you carve an ice sculpture, there is a certain time that you have to carve the ice block in. So in community health projects, it's like carving water. So you got to put yourself in nanoseconds, and you literally have a nanosecond time to carve that idea that you have in your head. So it just takes a lot. So thank you again. I really appreciate it. And I will send the link for Talk To again so that we all
Thank
can.
you.
So I'm also going to send you all the agenda for both tomorrow's meeting for the free clinic and for